Hi, this is Amy with Be Green with Amy, and I'm so excited to be here with the Vegetarian Society of Hawaii, and they are doing a presentation with Dr. Klaper is going to be here. He's getting set up right there, and there's a whole bunch of people here to see him, which is really exciting. And they've got all kinds of things for everybody to do, lots of tables with information about different things, events that are happening, and how to be vegan. And over here we have Dr. Klaper's wife. So it's going to be a lot of fun, and I'm really excited to see the presentation. So let's get ready to watch.
When I was asked to give this presentation, the original title that I proposed was The Keys to Healing, Plant-Based Nutrition, the Keys to Healing in the 21st Century. And that is indeed the truth of it. And during this talk, I'm going to be sharing with you a number of these keys to healing. And we're going to drill down a bit on the science so you can understand the power of a plant-based diet to really heal these bodies. And it's an adequate title, but it didn't have a lot of pizzazz to grab people on the internet. And I realized that there's another chord happening in my life these months, and that for the past years, my greatest joy has been sharing the knowledge of what food does to our bodies, good and ill, with the general public, and explaining these wonderful mechanisms that we're becoming more and more aware of. And as much fun as it was and is to heal individual people or help them heal themselves by adopting a healthier diet, where I was working at True North Health Center in Santa Rosa, California, seeing patients one at a time, I would put in a full day's work and have helped 8 people, 10 people. And though it's very fulfilling, when we look at the massive amount of healing that needs to be done and the metamorphosis of society's understanding of what our food is doing to us and what it could be doing for us, I realize that we're running out of time. We've got to reach a lot more people much more quickly. And there's a number of avenues in which to work: the general education of the public. You can work on the governmental level. You can work with the agriculture department. You can work with many different aspects of the plant-based world. But I realized one of the major hurdles, one of the major obstacles, one of the major problems in our society that's holding back this absolutely essential evolution that we've got to go through to get people really eating healthier is my beloved medical profession. And as wonderful a healing discipline that modern medicine is, and the stunning, astounding, wonderful healing they can do, pulling people back from the brink of death with medications and surgery, and God bless everyone who works in that profession in the hospitals and the urgent care clinics, etc. Doctors don't know much about nutrition, and their ignorance of it, their fear of it, their disregard of it is holding back this needed evolution. Meanwhile, people are dying, and our medical system is going broke, and my colleagues are not helping in their almost willful denial. Oh, anything but nutrition. Don't want to talk to the patient about what they're eating. It's almost like in the Harry Potter movies, you know, Voldemort, the name that must not be spoken. You know, oh, don't ask the patients about what they're eating. Oh no. Well, that can't stand. That's the problem. And if we're going to make any progress, I've got to go around and wake up my colleagues. And for the past 9 months now, I left my practice at True North to fully devote my time to helping wake up my colleagues. And with the help and sponsorship of the Physicians Committee of Responsible Medicine, I've been going around to the medical schools in the country because I want to talk to the first and second and third year medical students who are still fresh and open in their ideas, and I want to reach them before pharmacosclerosis sets into their brains. And as I step up to the podium with these young students, I tell them, I want to give you the lecture I wish someone had given me 50 years ago. 50 years ago, my heavens, 1968, I was a first-year medical student. And I wish someone had told me that as wonderful as medicine is, you're not going to be treating leprosy and smallpox, it's what your patients are eating. And if you get them on a healthy diet, most of these diseases go away. I wish someone had told me that. Would have changed every diagnosis I made, every therapeutic program that I designed for a patient. I totally neglected what they were eating. And it turned out to be a tragic overlook of this very, very powerful medium. And so now I'm trying to go back and correct that. So PCRMs has sent me around to the University of Michigan Medical School in Ann Arbor, up to Beaumont Medical School in Rochester, Michigan, down to Wright State University Medical School in Dayton, Ohio. Sent me up to Montreal to speak to the kids at McGill, going down to the University of Florida in Gainesville and talk to the Gators down there, then over to the University of South Florida in Tampa. And I want to reach the students and the faculties, because there's always some surgeons in the back in their white coats with their folded arms, all skeptical, but they're operating on people who are on their table for what they've been eating. And so my focus is trying to wake up my colleagues before it's too late for both their individual patients and our medical system. So hence I have retitled this talk, "Wake Up Doctor, Your Patients Are Eating Themselves to Death." And I know this talk is being recorded, but I'm assuming somewhere in the audience there's some health professionals, there are some physicians, some dietitians, some nurses here, and watching on their computers and on their TV screens, I'm certain there's some physicians and dietitians, and I want to reach them with this very important message. It helps if you turn on the controller. Okay. All right. Is there a reason that you are not? Oh, come on, don't do that. Okay. Well, with the magic of editing, good. Okay. This is the University of Illinois College of Medicine in Chicago, my alma mater. And I entered here, as I said, 50 years ago in 1968. I was a first-year medical student. Studied hard. I loved every aspect of medical education, anatomy, physiology, biochemistry. All of it is magic and wonderful and empowering. And after 4 years of intense study, 1972, I walked across the stage at McCormick Place in Chicago. They handed me my medical diploma and they called me doctor for the first time. As you can see, I have not changed a bit. And when I graduated, I thought for certain, after what I had learned, reading Robbins' pathology and Harrison's textbook of internal medicine, that I was going to be seeing 6 cases of leprosy every week. I was certain there'd be 4 cases of smallpox, at least 3 cases of diphtheria, 2, if I was lucky, of bubonic plague, and maybe the vaunted and ethereal Tsutsugamuchi fever. Been a physician 46 years. How many cases of leprosy I've seen? Saw one once in Louisiana. How many cases of diphtheria I've seen? Not, thank heavens. Still looking for that first memory in the back of the throat. Bubonic plague. And I'm still looking for my first case of Tsutsugamuchi fever. The reality is, in 46 years, mostly the patient I've been taking care of is Ken. Lovely man. I really like Ken, funny guy, family man, pillar of his community. But his body is a slow motion train wreck. He's obese by 60 pounds. He's on 2 medications for his high blood pressure. He's got type 2 diabetes. He's on insulin and metformin. His cholesterol and triglycerides are dangerously elevated. and he hasn't had an erection for years because his arteries are so clogged up. His wife Karen is a female version of Ken, and she too has the same conditions. Doesn't have erectile dysfunction, but she's got chronic yeast infections from the high sugars in her vaginal secretions from her diabetes. The reality is that most of my colleagues in medicine spend the majority of their time treating a rather small group of driven diseases. Of the classic Western patient, they're obese, they got high blood pressure, their arteries are clogged up, they've got type 2 diabetes, they're wheezing because their lungs are inflamed, their intestines are inflamed, their joints are inflamed, and they often have raging autoimmune diseases like lupus and rheumatoid arthritis. This is what occupies the majority of time of physicians and sucks up most of the trillions of dollars that our healthcare system spends on healthcare, but it's really disease care. And ask what my fellow physicians do most of the day. Well, they manage chronic diseases because after all, diabetes is not curable. The best you can do is manage it. High blood pressure is not curable. The best you can do is manage it. And so we manage these diseases. We become disease managers. Well, I don't know about my colleagues, but I did not go into medicine to manage chronic disease and fill out insurance forms all day. I went into medicine to cure people. And every one of these diseases is curable, every single one of them. Every one of us physicians who practice a lifestyle brand of medicine has a stable full of patients who used to have high blood pressure, who used to have diabetes, who used to have clogged arteries. Every one of these diseases will go away if you get these patients on a healthy diet. Yet the students and my colleagues are taught when they wonder what's the cause of these diseases, they run into two words: etiology unknown. We don't know what causes high blood pressure. We don't know the cause of type 2 diabetes. We don't know the cause of childhood obesity. And the implication is so disempowering. The implication behind this is, well, you lowly primary care physician, and this is way too complex for you to understand, but fear not, the smart research scientists in the laboratories at NIH and Harvard are working 24/7 to come up with the molecular mechanism behind these diseases, and as soon as they discover that and they design that magic molecule of amoxicillin, then they will release it to you and you'll be able to give it to your patients so they can keep on eating their cheeseburgers. Etiology unknown, really? It's not unknown at all. So I'd like to give my colleagues who are watching and you in the audience a nutritional reality check. You know, there's a saying, out of sight, out of mind. It certainly seems to be true where our food is concerned. We eat that burger, out of sight, out of mind. What's the Hawaii football team doing? Let me take you on a little journey about what really happens in your body when you eat these foods. If you were to eat a healthy meal based on whole plant foods, a whole food plant-based diet, you have a big salad, you have a hearty vegetable soup, there's quinoa and zucchini boats, here's a big plate of steamed green vegetables. You eat a meal like that, and an hour later, if I were to sneak up on you with a needle and a syringe in my hand, and when you weren't looking, draw 5 cc's of blood and let it sit in the tube for an hour, the clot goes to the bottom and the liquid part of the blood, the serum rises up to the top. And this serum should be crystal clear yellow. You can see, you can read newsprint through normal serum. It is crystal clear. This is what your blood's supposed to look like, and if you had a plant-based meal tonight without a lot of olive oil on it, this is what your blood looks like right now. But if you have a standard Western diet, you have a burgers, fries, and a shake, you have fried chicken, bacon, eggs, a pizza, pour a bunch of olive oil on your salad, you eat a meal like this. And an hour later, I was to sneak up on you with that needle and the syringe, and I draw that 5 cc's of blood, let that tube sit. The blood would look like this. This creamy appearance of the serum in the tube is called lipemia. Postprandial means after eating. This is what your blood's supposed to look like. This is the fat in your blood that you have just eaten. Not everybody shows it this optically densely, but everybody has a wave of fat that goes to their bloodstream after eating a fatty meal. How can you not? Well, where's it going to go? Of course, your blood turns fatty after you eat a fatty meal. And your blood stays this way for 5 hours. Here they gave someone a fatty meal at hour 0, and they drew blood once an hour for 6 hours. And they took those 6 blood tubes and they put them one after another into an instrument that measures how fatty the blood is getting, how milky the blood is appearing. And here you see the blood getting milkier and fattier and fattier and fattier and fattier until it takes the liver about 5 hours to begin to clear the fat out of the blood. Well, think of what this means when you consider how most Americans conduct their eating day. They start their day off with something fatty, an egg McMuffin, bacon, eggs, etc. And for the next 5 hours, their blood is running thick with fat. During this time, it's injuring their arteries, setting them up for atherosclerotic plaque formation. It's settling out on their bellies, making them obese. It's changing their hormone levels, setting guys up for prostate cancer, women up for breast cancer. Not a good thing to do. To turn your blood fatty for 5 hours. It takes the liver till almost noontime to begin to clear the breakfast fat out of your bloodstream, till you go for lunch. And you send another wave of fat to your bloodstream. And the blood stays fatty all afternoon, sticking to your belly, injuring your artery, changing your hormone levels, till about 6 o'clock in the evening, when your liver begins to clear this fat out of your blood, just in time to visit the colonel and send another wave of fat to the bloodstream. And the blood stays fatty all evening till about 10 o'clock at night, till on the way back to the bedroom, you stop and send another wave of fat to the bloodstream. People go to bed like this. And the truth is that most Westerners, even if they have chicken for lunch and salmon for dinner, most folks are keeping their blood fatty all day. Stuff never clears out of the bloodstream. You keep your blood fatty 20 years, 30 years, 40 years. You can't be shocked when some evil changes start happening in your body, which brings you to see people like me. Because there's consequences to keeping your blood fatty like this, day after day, month after month, year after year. There are big consequences, and it's way beyond obesity, and we'll come back and talk to you a bit about that as well. Because there's more than just fat in that blood. There is an evil brew of health-damaging molecules that create molecular chaos throughout your body. The heavy saturated fats make your blood thicker. Those fats stick to the red blood cells. The blood cells start sticking together and your blood becomes more viscous. Blood viscosity goes up after a fatty meal. That makes the blood flow more slowly through the capillary bed, slowing down oxygen delivery to your tissues. The fats stick to your fat stores, increasing obesity, but they also, as I'll show you in a few minutes, injure the ability to absorb sugar into your muscle cells and makes you insulin resistant. And as I mentioned, the fats also increase estrogen production, and saturated fats are pro-inflammatory. They set off inflammation throughout the body. All the salt that's in the burger and the fries and all the processed foods stiffen up your arteries. They make you retain fluid that raises blood pressure. And we're now seeing that the sodium actually turns on genes that set people up for autoimmune diseases like lupus. And all the sugars that are in the milkshake and in the starchy French fries, and the sugar in the ketchup, all the sugar that we eat does evil things that I'll share with you a little bit later. But it sticks to proteins throughout the body, forming these advanced glycation end products, and that damages the retinas of your eyes, the lens in your eyes, damages the skin and blood vessels throughout the body. This is just from the fat and sugar and oil and the salt in this food. But you can create this phenomenon just with vegan Oreos and Coca-Colas and potato chips. Okay? No meat involved. Vegan junk food will do this to you. Your body's never not looking. You can't tell your body, look over here and have a cheeseburger and some chips over there, like your body didn't know. Your bloodstream knows and just showed you what happens. But you decide to eat a diet that includes animal flesh. You include meat into this diet. You now add an entire separate layer of molecular toxins to your bloodstream that are specific to the eating of animal flesh. The very act of cooking meat, nobody's eating raw meat. And so the very act of cooking that chicken breast or cooking that salmon steak or that burger creates these atoms called free radicals. They are missing an electron, and they will rip an electron off any passing molecule like your DNA, like your cell membranes, like important enzymes and protein in your body. You don't want to eat a bunch of free radicals, and all cooked meat is teeming with free radicals. Only animals create this sialic acid called nu-5-GC. So what? Well, it sets off inflammation throughout the body. And if you stain for the sialic acid, you will find it in the coronary artery lesions. You'll find it in the joint inflammation and rheumatoid arthritis. You'll find it in various autoimmune diseases. And only meat has this stuff. And folks who eat a meat-based diet are eating this stuff 3 times a day. As our paleo-eating friends are going to find out the hard way. You don't want to eat nu-5-GC 3 times a day for any reason. Then we got to deal with endotoxin. Lovely stuff. What is endotoxin? All meat comes from the slaughterhouse. This is the grimmest of my slides. All meat comes from the slaughterhouse. Even organic grass-fed beef that animals led into slaughterhouse and killed. And there comes a point in the butchering process where the animals eviscerated, the guts are taken out, the digestive system. And inevitably there's going to be spillage of the gut bacteria, and as a result, every cutting surface in the slaughterhouse has a thin layer of bacteria, E. coli, Salmonella, Enterococcus, all cutting surfaces have it. So every piece of meat in the supermarket, wrapped in cellophane, has a thin layer of these nasty bacteria from the animal's intestines. Now, if the bacteria are still alive, you may set yourself up for E. coli and Salmonella and all those problems. But that's not the concern right now. Those bacteria die. They're short-lived organisms. And as a result, when the cell walls of these bacteria break up, they form a molecule called endotoxin. This is nasty stuff. This sets off inflammation throughout the body, starts clotting your blood, depresses your heart muscle, releases histamine, tumor necrosis factor, kills tissue around the body. All of this is released from endotoxin. And again, if you're eating a meat-based diet, you're eating this stuff 3 times a day. And one thing it does is it makes your gut leaky. It injures the intestinal membrane, which allows food proteins to start leaking out into your bloodstream and flowing through your joints, setting off inflammatory arthritis, flows through bronchial membranes, makes asthma worse. This is the result of eating endotoxin. And endotoxin is heat stable. So that means cooking the burger does not get rid of the endotoxin. Grilling the salmon does not get rid of the endotoxin. And so our meat-eating friends are eating a shot of endotoxin 3 times a day. Then we got this lovely molecule called carnitine. Called TMAO. What's that? Well, it turns out that the food we eat determines the bacteria that live in our gut. If you eat a bunch of sugar, you're going to summon up sugar-eating microbes. If you eat a bunch of animal flesh, you are consuming large amounts of molecules called carnitine and choline. And you are going to summon up microbes that eat carnitine and choline. They have names like Pipistrellococci, Clostridia, so what? Well, these microbes don't care about you. They're waiting for that next chicken breast to come down, or that next salmon steak to come down, or that next egg to come down. Because they will take the carnitine and choline and turn it into a molecule called trimethylamine. So what? Well, your liver turns that into trimethylamine oxide. This is a molecule from hell. This drives cholesterol into the artery walls. And it's a major inflammatory driver that starts off the formation of atherosclerotic plaques. And the paleo folks are eating this stuff. Well, they've got a hardy population of these microbes in their gut from all the meat they're eating. They've got a vigorous population of these microbes. And so they're walking around with high levels of TMAO, and as a result, they're setting themselves up for bad artery disease, heart attacks, and strokes. And these are the guys who drop dead at the gym at 49 on the treadmill. Ooh, he looks so healthy. But inside his arteries, he was an old man because he's eating a diet of mountain lions, not of human beings. By the way, if you give a steak to a vegan, they don't make this stuff because they have not spawned the microbes in their gut to make TMAO. It's another validation that we should not be eating animal flesh. We have the same digestive system as our gorilla and bonobo cousins who are up in the trees tonight eating leaves and fruit, which is really what we ought to be eating as well. Now, your house cat or a mountain lion will not develop this molecule either because their guts are so short they move it right out of their intestine before they spawn these kind of microbes. But eating a flesh-based diet for us hominids violates natural law, and here's one way that comes back to bite us. Very active cooking animal muscle creates heterocyclic amines, and these set off cancers. And if someone asks me, Doc, I want to cause a colon cancer, how do I do that? Well, simple, pack your colon full of meat 3 times a day, let that rub on your colon wall for a few years and see what you set off in there. And it's no accident that most colon cancers start in the descending and sigmoid colon because that's where the exposure time is the longest. That's where the meat residues linger and rub on the colon wall day after day after day. And it's no surprise that these folks have an alarming rate of colon cancer as well. And again, the very active cooking meat creates these advanced glycation end products that damage protein throughout the body. And finally, the animals in the feedlots that you buy their parts at the supermarket have been in that feedlot for weeks or months, eating bushels of grains that have been sprayed with herbicides and pesticides that bioconcentrate in the animal's flesh. They wind up accumulating all these nasty hydrocarbons that people then eat in the burgers and the hot dogs. These animals drink water that is contaminated with lead and mercury and cadmium and arsenic. That winds up in their flesh as well. And these animals are given growth-promoting hormones, are given antibiotics, that all concentrate in their flesh. So every burger, every piece of chicken or turkey you are consuming is laced with all these molecules. This is the reality of a flesh-based diet. All right, the contrast is not good here, but these are specific meat-based toxins. The food that you eat is supposed to bring soothing, stabilizing molecules, but you eat a flesh-based diet, it's like that hot lava on the Big Island that causes damage throughout the body. And to my fellow physicians, I would ask, are your patients keeping these molecules in their bloodstream day after day after day, or are they not? Because if they are, you are dealing with a chronic toxicity of the tissues that is going to result in disease in various manifestations that you're going to have to deal with. And yet, my colleagues practice medicine like what our patients are eating has no effect on these diseases. It's stunning. Modern medical science is able to identify a genetic mismatch on gene A21 on chromosome 14. That we can identify, no problem. But the thought that eating cheeseburgers and pepperoni pizzas might be clogging up our patients' arteries, this is too abstruse for my colleagues to comprehend. Why is that? I'll give you my speculations on that in a minute. My colleagues, when it comes to nutrition, are working with a model from the 1950s. The nutrition I learned in med school said, oh, nutrition is simple stuff. You just need some sugars for energy, You need some proteins to build structures and enzymes, and you need some fats to get you through the next famine. That's it. Have some of each every day. Have some protein, fat, and carbohydrates, and you'll be fine. And throw in some vitamins and minerals, and that's all you need to know about nutrition. That's outrageously inaccurate and oversimplified. The reality is that I want my colleagues to understand is that our food is chemically alive. Within minutes of eating anything, molecules of that mouthful of food are flowing through every cell in your body where your DNA lies unfolded. And the molecules from that food wash through your cells and they play your DNA like a piano. And these molecules turn genes on and they turn genes off. They turn enzymes on, they shut enzymes down. Every molecule, every meal changes us on a molecular genetic level. Food brings in not only nutrition and nutrients, it brings in information. In this digital age, we can't be surprised that food changes us. The science is called nutrigenomics, and it's how your food turns your genes on and off. And to practice medicine like this doesn't happen, to eat food thinking this doesn't happen, it can be a fatal intentional blindness. No wonder we're getting all these diseases. And all you see is the commercials on the TV to go eat this pizza and that chicken breast and that burger. But meanwhile, what is it doing to you on the genetic molecular level? In one sentence, you can define nutrigenomics. People blame their genes. You may have a genetic propensity to diabetes or to high blood pressure. Your genes may load the gun, but your diet and your lifestyle pull the trigger. Whether that disease actually manifests in your body depends on what you're flowing through your cells hour after hour, day after day, year after year. You don't need to be a geneticist to understand that the genes that are going to be turned on by this food and all the contaminating molecules that it contains, those genes are going to be fundamentally different than the genes that are going to be turned on by this food. It's the difference between 1 and 0 in computer land. You're either running those toxins through your tissues and dealing with all the genetic sequelae of that, or you're not. Because you run a plant-based diet, especially a unprocessed, whole food plant-based diet like nature intended through your tissues, and you're bathing your tissues in all these stabilizing, antioxidant, reparative phytonutrient molecules that wash through your cells and give your tissues the chemical message, everything's okay, got high quality fuel here, no disease, no inflammation is necessary. Your food stream runs through your tissues like a river, turning genes on and off in every cell. The question is, what's the quality of that river? I mean, it really is. We're talking about this watery flow through your tissues. What's in that river? If you're eating this kind of food and that river that's washing through your cells are filled with all these toxic molecules, it's like a polluted river that you're running through your tissues day after day after day. And it's going to hurt you in 2 ways. And to my scientific colleagues watching this presentation, the food is going to change you one of 2 ways. It's either going to turn genes on and off directly, like the TMAO does as far as setting off inflammation, etc. Or the food is going to change the microbes that live in your gut, and they will change you because their waste products are neurotransmitters. They put out dopamine and norepinephrine that will change your emotions. They will change your resting autonomic nervous system. These microbes are not passive bystanders. And the thing that determines whether you got friendly microbes or unfriendly microbes is the food you're putting down in your gut. This is serious business, but it's also promising and exciting because you've got control. Put healthy plant-based foods down there, you're going to spawn microbes that do wonderful things for you, just like nature intended. So, it said that at age 20, you have the face that nature gave you. At age 50, you have the face that your choices have given you. Brings us to this illustration by my friend Baxter Montgomery, a cardiologist down in Houston. What he's saying is that the Western diet has become so toxic that it washes through all our tissues. And from this tree trunk of bad nutrition, all this evil fruit of heart failure and high blood pressure and allergies and headache and obesity comes from it. And to not understand it, to practice medicine without understanding the effect of your patient's diet on the body that's sitting in front of you is like the fable of the blind man and the elephant. A bunch of blind men come up on an elephant, one grabs the leg, the elephant's like a tree trunk, one grabs the tail, the elephant's like a rope, one grabs the trunk, the elephant's like a snake, one grabs the ear, the elephant's like a fan. They all have hold of the same elephant, but none of them have the faintest clue what a whole real elephant really is. Well, that's the problem that my specialist colleagues are facing. Because the patients are eating this toxic diet, all these disease and imbalances are set off, and the cardiologist sees the clogged arteries, and the internist sees the high blood pressure, and the endocrinologist sees the type 2 diabetes, and the physiatrist sees the sore joints, and the rheumatologist sees the autoimmune diseases, the neurologist sees the strokes, the dermatologist sees the psoriasis, and the hives, the gastroenterologist sees the irritable bowel, and the colitis, and the Crohn's disease, the surgeon sees the diverticulitis. They're all looking at the same disease. It's what their patients are eating. Etiology unknown. Not in my book. It's ask the patient what they ate yesterday. You'll understand why they're sitting in front of you, obese, diabetic, hypertensive, inflamed, and clogged up. I've got a plaque in my office, says it in 3 words. Patients sit in front of me, Doc, why am I on all these pills with all these medical problems? It's food. It's been the food all along. And I would urge everyone watching this presentation and in this audience, if you've got a medical issue and you're not eating a plant-based diet, and you've got a pain, or you've got fatigue, you've got high blood pressure, you've got this or that, bowels aren't working well, your skin's broken out, before you ask your doctor to order another $500 panel of blood tests and another $1,000 scan, stop. What'd you have for breakfast yesterday? What'd you have for lunch? What'd you have for dinner? What do you really eat? And I asked my colleagues, ask your patient, take me through yesterday's eating day. What'd you have for breakfast, lunch, and dinner? And if the litany comes out of the egg McMuffins and the buffalo wings and the burgers and the fried chicken, you know everything you need to know. Stop. Don't order any more tests. Send that patient to a plant-based dietitian and get them on a truly healthy diet, see them back in a couple of weeks, and see if they're able to comply or not. But that's where to focus. It's not some genetic mismatch on gene A21. It's what they're freaking eating, and you gotta finally come to grips with that. But we don't. My colleagues and I, well, I do, but my colleagues don't. Why? Why the disconnect? It seems so evident. How can food not be the major determinant of health or disease? But my colleagues, like Voldemort, they won't see that. Why don't most doctors recognize nutrition as important? I think there's 3 reasons. First of all, we're not taught anything about it. Medical school, I got 4 lectures in nutrition. Nutrition for burn patients, nutrition for patients with kidney failure, nutrition for children with growth retardation, and nutrition for Tsutsugamuchi fever. I can't even remember what the other one was. I gave a lecture at Harvard a few years ago, and the young medical student picked me up at the airport, and I asked her, do you get any lectures in nutrition? She rolled her eyes. Yeah, we got 4 lectures. I said, what are the topics? Nutrition for burn patients, nutrition for patients with renal failure, nutrition for kids. Nothing's changed. You don't learn anything about it. And so many doctors say, oh, don't ask me to tell patients about nutrition. I don't know anything about the subject. And that's an intolerable piece of ignorance that we are holding on to for no good reason, to say the least. Second, physicians do not respect nutrition as a discipline. It's a science, it's a sissy science. You're a young fourth-year med student, you're an intern, you're a surgical resident, man, you want to be up in that OR doing real medicine, man, you want to be fixing broken arms and delivering babies and suture lacerations. Nutrition, boring stuff. Yes, I don't do dietitians, you're given a 2,000 calorie diet, don't run. And now it's become evident that the price of that regrettable piece of arrogance is that these young, noble, erstwhile surgeons will spend the rest of their careers up in the OR at 3 in the morning, out of their warm beds, dealing with the infections and the infarctions and the amputations from what their patients are eating. They're going to be dealing with nutritional diseases the rest of their career, and they've got a patient on death's door with a blue leg on that table, but if they had seen them in an outpatient clinic 2 weeks before and said, that leg's a little dusky there, why don't you go see Ms. Smith, a plant-based dietitian, she'll get you on a healthy diet, and walk every day, come back here in 2 weeks, let's see if that leg's got a little better circulation to it. You might have saved that patient in surgery to begin with. And the cardiologist doing their cast, same thing. These are preventable, reversible diseases if you get them on a healthy diet. But we don't respect nutrition, we don't appreciate it. And the third reason I think that doctors are reluctant to talk to their patients about healthy nutrition and proper foods is, lest I say it, they're eating this stuff themselves. They're eating their burgers and their pizzas, and you see what they serve in the hospital cafeterias, you see what comes up in the trays of dietary, they like their KFC, they're not going to tell their patients don't eat this stuff, they're eating it themselves. And you wind up with that saddest of situations of obese doctors taking statins and hypertensive agents, and they're sick themselves, and they get their colon cancers, and they get their strokes. How sad. Talk about the blind leading the blind. You want your physician to be a healthy man or woman when he walks in that exam room door. You want to get a feeling this person knows something about health. And yet, we think that giving them these potent drugs and that, and you've helped them. But really you haven't helped them, physician, heal thyself. So I think this is why we've got this inertia that needs to be overcome. And that's where I'm devoting the rest of my professional efforts to accomplish. Because they're playing, don't want to deal with nutrition. And people are dying. This is not funny any longer. Real people are getting real strokes and real heart attacks and real cancers because their physicians aren't asking that question, what do you eat? Take me through your eating day. That's why they're sitting in front of you, doctor, overweight, hypertensive, diabetic with incipient malignancy because of the wrong fuel going through the body. When you get a patient on a whole food plant-based diet, the changes are nothing short of spectacular. It is the most gratifying thing that I can witness in medicine. You get a person like this and like this, run the vegetable soups and the salads and the steamed veggies and lentil stews through their body, and the obesity starts to melt away, and the arteries open up, and the high blood pressure goes down, and the joints stop hurting, and the lungs stop wheezing, and then migraine headaches go away, and the bowels stop running with diarrhea, and their skin clears out, the psoriasis goes away, and they turn back into normal, healthy people who don't need the services of people like me, and that's just fine with me. I tell my patients, I want to see you in 2 places and 2 places only. I want to see you at the health food store and on the bike path. That's the only 2 places I want to see you. And that's what comes to pass with a healthy diet. But yet, this information is not given to our patients. And that cannot stand. The principles of medical ethics, the American Medical Association clearly state, a physician shall continue to study, apply, and advance scientific knowledge and make relevant information available to our patients and to our colleagues, which I'm going to do tomorrow when I go over to Triplet and talk to the doctors there, and to the public, which is what we're doing here tonight. We are mandating to share this information with our patient. And therefore, withholding this information literally is unethical. How dare we withhold this? We can cure these patients. And yet we give them the statins and we say, take these statins, then go eat your cheeseburgers, it's fine, you're on your lipid. How fraudulent is that? How cowardly is that? My medical colleagues, in their sincerity, they don't know, but they're really letting their patients down. And it's time for a new era of nutritional awareness to dawn in my profession. So to the physicians here who say, well, I don't know anything about this, I'm not sure this really works. Let me tell you, don't fear this. There is good news waiting for you if you just open up that little door and mark your patient's diet. Let's take some of the classic diseases. How about Crohn's disease and ulcerative colitis, inflammatory bowel disease? What life-shattering diseases these are. In Crohn's disease, you get these areas of the small bowel, the large bowel turn red and angry and bleeding, and the person has bloody diarrhea every 20 minutes. They're running to the bathroom constantly. You can't go to a movie. Air travel is a nightmare. Your social life fragments. Also, colitis is similar. But you ask the gastroenterologist, do you think what your patient's reading has anything to do with this? What do you put what kind of food do you tell your patients to eat when they have Crohn's and colitis? It doesn't matter. Let them eat whatever they want. I want them to get some calories in. And they'll tell you three things. Diet doesn't matter, because what the patient eats has no effect on these diseases. And besides, there's never been any study show that diet makes any difference. And doors closed, slam, and put my cousin, the gastroenterologist. And this is what he tells me. Say, really? Really? Never been any studies show that diet makes any difference. Doctor, have you taken the time to look? Really? You sat down, fired up your search engine, typed in inflammatory bowel disease and nutrition or diet. If you take the time to do that, your screen will fill up with studies showing that diet has absolutely the determining effect on the inflammatory state of that diet, of that bowel. Study after study shows it. And in fact, I'm going to zero in on one of these by Pfeiffer on dietary clues of where Crohn's disease is coming from. But as scientists, I would ask, whether their diet has no effect on it. Really? Are you telling me that if you got a patient with a intestinal tract that looks like that, you put in a colonoscope in the rectum, and this is what you see when you look at the wall of their colon, are you telling me with a straight face that there's no difference if that person is eating chili dogs, black coffee, French fries, and beer, and smearing that on the membranes, versus what we do up at True North, blended squash and papayas and rice gruel and melon and mashed bananas? Are you telling me there's no difference that between those two varieties of molecules? How can you say that with a straight face? By the way, here's what my colleagues in gastroenterology are not understanding, and you're going to have a better understanding than they do. What's really going on is this. Here's how food really sets off Crohn's and colitis. Here we are down in the intestine, these little finger-like villi that stick out from the wall of the gut for absorption. These villi put out mucus, and in the mucus lives our microbiome. These is where all these trillions of organisms live, in this warm, nutrient-rich mucus. And they do wonderful things for us. They make vitamins, they digest fiber and starches. It's good to have these microbes there. But you want the microbes loosely floating in the mucus. You don't want them adherent to your tissues, burrowing into the tissues and causing infection. You want them just lightly dancing around here. And there are clearance mechanisms. There's proteins and various electrical charge mechanisms that keep the microbes from actually sticking to the tissues. But as Pfeiffer's study showed us, dietary components such as animal fat, high sugar intake from the colas and the Oreos, gliadin from gluten, And the consumption of emulsifiers, these low-grade detergents that keep the candy bars soft, maltodextrin, cheap junky sugar, all this stuff smearing along the gut wall injures the gut wall, and it paralyzes the clearance mechanism that keep the microbes from sticking to the intestinal wall. And so they do. And you get it, E. coli and other microbes actually adhering to the gut wall, invading it and setting off this hellacious inflammation. It's the food, it's the food, it's the food. How can you say food has no effect? It's the main reason that these gut walls are so inflamed. But you get these folks on a healthy diet and things change. The food we eat determines the microbes that live in our gut. And you get them on a whole food plant-based diet, and the bad guy bacteria shrink down in numbers, and the good guys step up, and the patients benefit. When you eat animal flesh, you summon up a population of bacteria from the Bacteroides family. These are nasty guys. They set off inflammation, and they split the bile salts coming from your liver into cancer-causing carcinogenic substances. You don't want a lot of these guys there, and a meat-based diet summons them up. But you should switch to a plant-based diet, and within days, you start summoning up the microbes from the Prevotella family, and these are friendly guys. These are the ones that you want down there. And within 72 hours, it starts to change. The food you eat determines the microbes in our gut. And to pretend that what our patients are eating has no effect on these diseases, it's a willful denial of the reality that's becoming so evident to even the public now. And you can get these folks in remission and stay there. This was a lovely study out of Japan. They took 16 patients. These were young folks with Crohn's disease, and they got them into remission with a healthy diet. And the only advice they gave them is just eat meat once a month or twice a month. Basically, it was a semi-vegetarian diet. And of these 16 folks, remission was maintained. 15 out of 16 of them for 2 years had no symptoms just by getting their meat eating down to once or twice a month and just eating vegetables. Because it changed the microbes, which changed everything. How can you say food has no effect? And in fact, my colleagues in gastroenterology, all their patients on a given day, whether they're seeing patients with colon cancer, appendicitis, tuberculosis, these are all from a diet based on meat, dairy, low-fiber foods, and overly processed products. Get them on a healthy plant-based diet, and almost all of these go away quickly. Good news as well for my colleagues in endocrinology who deal with type 2 diabetes. Oh, diabetes, oh, that's a sugar disease. Don't eat sugar, stay away from those carbs, don't eat sugar. Is the problem from too much sugar? No. What's the problem? I mentioned most folks who eat a Western diet are keeping their blood fatty all day. What's the problem with keeping your blood fatty all day? Type 2 diabetes is largely a disease of fat toxicity, because the fat doesn't stay in the bloodstream. It deposits out into 4 tissues that make you go diabetic. Increases your fat stores, and I'll show you how that becomes a problem. It gets into the muscles, which I'll show you. Also makes the liver insulin resistant and damages the pancreas, but I want to focus on the fat in the muscle right now. This is a muscle cell. Muscles. It burns sugar, glucose. You eat an apple, sugar winds up in your bloodstream, but you got to move that sugar into your muscles so you can burn it. So in order to get the sugar from your bloodstream into your muscles, your pancreas puts out this little protein called insulin, and it opens up the insulin receptors on the surface of the cell, and that allows the sugar into your blood, into your muscles that can be burned for energy. Yay, that's the way it's supposed to work. But you eat your bacon and eggs and burgers and buffalo wings and olive oil and all these fats, and you eat a high-fat diet, as the paleo and the keto folks are going to find out the hard way. All that fat, you keep your blood fatty day after day after day after day, this fat starts oozing into the muscle cells. And here you see it represented here. It's called intramyocellular lipid. Intra means inside, myo is muscle, cell is cell, lipid is fat. This is fat in the muscle cell. This is not theoretical. I am not making this up. Here's what it looks like under the microscope. This is muscle, and all this black stuff is fat in the muscle cell. Should not be there. This is intramyocellular lipid. If you look under the electron microscope, you will see it as well. This is fat in the muscle cell, doesn't belong there. So what does it do? What it does is clogs up your insulin receptors from the inside. And so when insulin comes along and says, okay, open up to let the sugar in, it's like putting chewing gum in the door lock. And the insulin receptors don't listen to insulin's message. And so people become insulin resistant, so the sugar piles up in the bloodstream. You wind up with these high blood sugar numbers. But the problem isn't from eating too much sugar, it's from eating too much fat. For the scientists who are watching and my clinician colleagues, no, it's not actually clogging up the insulin receptors. What it's really doing, in order to get sugar into the cells, it's an active transport process that requires two kinase enzymes, this one, and all this fat builds up, turns into free radicals, and which inhibits these kinase enzymes, and that's really what's keeping the sugar from being moved into the muscles. So when I say it clogs your insulin receptors, it's really inhibiting these two kinase enzymes. Okay, and this is not, again, theoretical. If you do a search on intramyocellular lipid and insulin resistance, you'll see that it's clearly becoming the accepted mechanism. Now, I mentioned the issue with obesity. It plays in directly to type 2 diabetes, and here is how that happens. I've been a physician 46 years. I entered medicine, clinical practice in the late 60s, early 70s. And in the intervening 40 years, I have watched the tsunami of obesity sweep through our society. It's been stunning. And obese people, and I'm not fat shaming, but we all see obese people are everywhere. I had surgery a couple of years ago in the hospital. The surgeon was obese, the nurses were obese, the orderlies were obese, the x-ray technician. You got on the airplane, the pilot was obese, the flight attendants were obese. It's really becoming quite epidemic. And do we get alarmed about this? Not really. What we've done is normalize it. Well, that's who we are now. We're Americans, we're fat, and that's who we are. And if you've got a problem with that, that's your problem. I'm fat now, just the way I am. And if people are psychologically well adjusted, fair enough. I don't want people to be overly distressed. But if they have this attitude, yeah, I know I'm carrying too much fat, but it's okay, doc, it's okay. From the physician's point of view, it's not okay. Diabetes is a disease state, it's a state of inflammation. Here's why. This is a plastic model of an obese abdomen cut in sagittal section. What's making that big belly so big and fat? There are two kinds of fat in the abdominal cavity. The fat under the skin, the subcutaneous fat, is a unique kind of fat because it's metabolically active and it produces estrogens. It is the largest estrogen-secreting tissue in the body. If you are a woman with a breast lump, you do not want 40 pounds of estrogen-secreting fat plastered on your abdominal cavity. It's a great way to give yourself advanced large breast lumps. Drives breast cancers, the uterus responds, you wind up with fibroids or heavy periods and anemia. Not a good thing to be obese from the endocrinologic point of view. Guys, estrogens make the prostate unstable. Great way to give yourself prostate cancer, man boobs, not a good thing to have 30 pounds of estrogen-secreting tissue plastered on your abdominal wall. This is just the fat under the skin. But the fat inside the abdomen, different creature, metabolically different tissue. And this fat wrapped around your intestines puts out a series of proteins called inflammatory cytokines, not friendly molecules. They drive inflammation throughout the body. And if you look at this hall of horror of conditions that have inflammation driving them, you can see why people who are obese have a higher incidence of these conditions. So where does this enter into the diabetic picture? Having an abdomen like this is like having an ailing being in your body, and it drives inflammation, promotes diabetes, and fuels cancer growth for sure. How does it promote the diabetes? Because here we are back to the muscle cell. The intramyocellular lipid is clogging up the insulin receptors, inhibiting the enzymes from the inside. But here comes these cytokines from the obese belly, and they interfere with the insulin receptors from the outside. So it's no surprise that people who are obese wind up developing insulin resistance and florid type 2 diabetes. It was published in that prestigious medical journal called The good news is, you get these people on a healthy plant-based diet, get them taking a walk every day, this all goes away. And what happens, these muscle cells will burn the fat in the muscle for energy. And the insulin receptors open up, and diabetes goes away, and they're no longer diabetic. This is a completely reversible disease. If you have it, you still have some pancreatic function, this disease goes away. And yet my colleagues, the best we can do is manage your diabetes, take your metformin, and we may have to, oh boy, the commercials at 6:30 in the evening on TV for all of these diabetic, we'll get those A1C numbers you're looking for. Yeah, oh, I got, I'm down to 7, yay, got a good number. How about curing this disease? Why don't you ask this patient what they're eating? But it's so dishonest to say, oh, you keep eating your burgers and your pizzas, but take your glutamide or whatever $1,000 drug you're trying to sell them. This is a dietary disease. It has a dietary cure, and to withhold that information from the patient is unethical. Whole food plant-based diet is the definitive treatment for type 2 diabetes. There's Emily, this is what she looked like. She adopted a healthy diet, she turned into that Emily, and her diabetes went away. Surprise, surprise. As I mentioned, all of us lifestyle docs, we have dozens of patients who used to have type 2 diabetes. It goes away. It's not really a disease. It's kind of defense mechanism that the body has to keep too much sugar from flooding into the tissues. But it's like driving your car in passing gear. You don't want to do that hour after hour. It's a stress on the body from the wrong diet going on. And completely reversible. Here's Dr. Barnard's classic study. They put people on a whole food plant-based diet compared to the Dietetic Association's diet. Their hemoglobin A1C dropped more, their body weight came down, their lipids came down, their kidneys got healthier. Here they are. Here's the Diabetic Association diet. Here's the vegan diet. And a year and a half later, they still had better A1Cs. Their weight was still down. Their LDL is still better. It's surprise, surprise. It's a healthy diet that shows up. And if you have type 2 diabetes, or you are a health professional who needs to learn about this, then please go to the PCRM website, pcrm.org, and they have wonderful, wonderful CME and patient guide materials on managing diabetes and curing diabetes. And we hear those two words put together very often, curing diabetes. You can do that, absolutely, type 2. The foods, it doesn't matter if you go back for a fourth bowl of vegetable soup, who cares? It's vegetable soup. There's fiber and water. There's no portion control. You don't have to count calories. It's eat till you're full. There's salad and veggies and steaming greens and lentil stews, and have all you want. It doesn't stick to you, and it leaves you nice and lean and healthy. You have to count carbohydrates and taste good. There's Italian food, Chinese, East Indian, Mexican, the food tastes great. And people do well, but you adopt this diet, and both the client and the owner of the diabetic body and the doctor taking care of them. You got to be prepared to lower those medications that are going to go into hypoglycemia if they're on too much metformin, too much insulin. So you cut those doses in half and half and half to stop them. Before we leave the diabetes world here, there's a particular nasty aspect called diabetic neuropathy. If you have diabetes with high sugars year after year after year, the nerves in your legs can get injured and you feel like someone's got a blowtorch on your feet. It's a dreadful, painful condition. And the doctors don't know what to do with it. They give them gabapentin and opioids, and they throw up their hands. They don't know what to do with it. They cut the nerves. If they would just look in the literature, they would find the study of Dr. Milton Crane up at the Weimar Institute in California. Took 21 volunteers with painful diabetic neuropathy, put them on a whole food, plant-based diet, low-fat diet, gave them a whopping dose of B12 every day for 2 weeks, and sent them out for a walk. And of the 21 folks, 17 became pain-free, 41 had partial improvement within 2 weeks. This is also a reversible condition. Instead of throwing up your hands, why don't you ask the patient what they're really eating? There's good news for our patients, for our clients, for our colleagues in rheumatology who are dealing with the folks with the inflamed joints. And again, this has a lot to do with the leaky gut issues. But you ask the rheumatologist, do you think what your patients are eating has anything to do with these sore joints? They laugh at you. No, of course not. After all, the stomach's in here, the joints are out there. How could they have anything to do with each other? No, that's the GI guys. We don't worry about that. Doctor, really have no effect on disease? No, I've never been any study showing that food has any effect on inflammatory joint disease. Really? Have you taken the time to look? You sat down, fired up your search engine, typed in diet inflammatory joint disease? You'll find your study. Your screen fills up with studies. And you will inevitably run into the study by Jens Kelsenkrog in Norway. 27 patients with rip-roaring rheumatoid arthritis were taken out to a health farm, got them out of their kitchens, and put them on a short water fast and then a gluten-free vegan diet for 3.5 months. After 4 weeks at the health farm, everybody was better. The swollen joints were down, pain scores down, the morning stiffness down, grip strength better, their blood tests, their SED rate, their C-reactive protein, everything got better because food washing through those joints has a major, major influence. How about the pulmonologist? Ask them, your asthma patients, do you think that what your patients are eating has anything to do with their asthma? Never been any studies that show food has any effect on asthma. Really? Have you looked, Doctor? If you have, you will find Lindahl's classic study. 35 patients with active bronchial asthma, they're wheezing, they're taking albuterol, prednisone, put them on a plant-based diet for a year. In almost all occasions, medication was withdrawn or drastically reduced. Significant decrease in asthma symptoms. 92% of folks in a year were better. When you pull the dairy out, especially, dairy proteins especially irritating for folks with asthma. For them to say the food has no effect on these diseases. It seems almost a little arrogant. Oh, I don't want to deal with that. I'm just a lung guy. Don't ask me about food. You can't practice medicine like that any longer, doctor. You must ask these people about their diet. How about the dermatologist? Food has nothing to do with acne. Really? If you've taken the time to look, you would learn the effect, especially of dairy protein, of casein and beta-lactalbumin, as they flow through the skin. They are notorious for setting off acne lesions. And you get these folks on a plant-based diet and their acne gets better. Here's the Nelson girls improved when they got the dairy and the soy out of their diet. And finally, are we running out of time? Am I running too long? About another 10 minutes? Okay. All right, the last thing is atherosclerosis. I want to free you from the tyranny of the numbers of people are afraid of their LDLs and their particle size and all that stuff. All these questions miss the point. The question is not how high is your cholesterol. The question is how healthy are your arteries. The issue is oxidized cholesterol. Cholesterol is not an evil molecule. Your liver makes it, so your adrenals can make cortisol, so your estrogens can be made, so testosterone can be made. That's why your liver makes it. When metal rusts, that's you rip electrons off metal, you see what happens. Well, when you eat these processed foods, you're eating a bunch of free radicals that rip electrons off cholesterol, and you wind up with oxidized cholesterol. And here's the process. The oxidized, this is the wall of the artery here. The oxidized cholesterol from the food winds up going into the artery wall. That summons in these macrophage cells that release more free radicals, and that's what these lesions are. The most important thing to know about your arteries and cholesterol is that atherosclerotic plaques are not just globs of grease that stick to your artery walls because your LDL is too high. These are inflammatory lesions. These arteries are being injured by meal after meal of animal protein and alcohol and cigarette smoke and phosphoric acid in the cola drinks and the high fructose corn syrup and the hydrogenated oils. All the molecules in the processed foods are ripping up these internal lining cells, and that's the problem. It doesn't show up in a calcium score, but it will show up in inflammatory markers. If you really want to know what's happening in arteries, then measure inflammatory markers like oxidized cholesterol and these other ones, myeloperoxidase, phospholipase, that you get from these specialized labs, including heart lab. But I don't care about your LDL. It's not a matter of driving your LDL down with statins. It's healing your arteries with a plant-based diet. And if you do, as Dr. Esselstyn tells us, all the antioxidants in the green vegetables seep into the artery walls. They neutralize the free radicals, so these cells don't have to. These cells leave, and as a result, those plaques get smaller and smaller and smaller, and the endothelial lining reestablishes itself, not by magic, but because your bone marrow is putting out showers of stem cells that reupholster the arteries and turn them back into normal arteries. And you get these spectacular reversals, and this artery turns into that artery. We've known this since the 1970s. You see these improvements in the heart and the peripheral blood vessels. You see blood flow, and blood flow everywhere improves. So instead of managing these diseases, how about curing them? People say we adapt to a meat-based diet. We don't adapt. That's what these diseases are about. If you've got a brand new car with a gasoline-burning engine, it's made to run on gasoline. If you start drizzling diesel fuel, which is kerosene, into the engine, it's going to start running rougher and rougher and rougher. The more kerosene you add, black smoke's going to come out, and eventually it's going to seize up. And you wind up in this situation. This was never not a gasoline-burning engine. It didn't adapt to the oily fuel. That was the problem. And we are herbivorous burning creatures. We are meant to burn plant material, and animal flesh, a little bit you can tolerate, but you start putting animal flesh in these plant-burning organisms, and you're going to cause disease. So, a plant-based diet, instead of a polluted river, is a clean river going through your tissues. The analogy might be a little poetic there, but the water in this cleansing river is the water in the fruits and vegetables that you want to wash through your cells meal after meal. And if you do, these diseases go away. The changes are spectacular. So I've been going around to the medical schools, in McGill, in Wright State, to try and get these young students to understand it's the food is what your patients are eating. We were brought down to Columbia, because in South America they're waking up to the same message. This is happening worldwide. It's really exciting. So Hippocrates was right. We're understanding it. Let food be thy medicine, and let medicine be thy food. I never did understand what that meant, but now I get it. When I've got patients with clogged arteries and high blood pressure, I tell them, every salad you should look at, oh, that's medicine for me. Oh, that kale over there, that's medicine for me. Oh, that vegetable soup, that's medicine for me. Let medicine be your food. And each one of these will help cure you. It's the food, it's the food, it's the food. My cynical doc friends say, well, people, they'll never change. Yes, they do. Now it's 2018, people are becoming aware, and they are changing. You can't count anybody out. That's not fair. Whether they change, doctor, is not your business, but you owe them the information to withhold this. Hey, you got a lot of diseases. You can they'll mostly go away with a plant-based diet. You at least owe them that piece of information. The plant-based wave is breaking. There's lots of films now to educate yourself, and lots of books to read. do what you can do. Go to the Forks Over Knives website and look at the recipes in their cooking course that will guide you into a life of healthy eating. Go to my website, and I've got a video on thriving on a plant-based diet. We talk about proper food selection, transition traps, overweight vegans, underweight vegans, cold all the time. That's in my Thriving on a Plant-Based Diet. Everybody can do something. Have a plant-based potluck, and pass out literature, start a support group, and go to the Veg Festival. And it's happening in Michigan. There's dozens and dozens of plant-based support group now, and you can start one here. There are courses to take online. Jeff Novick, PCRM, NutritionFacts.org, Dr. McDougall has a course, Dr. Furman has a course. There's lots of information. Stop this, if you're watching this video, stop it and take a picture of this screen and start educating yourself. And you should read about the environmental effects of an animal-based diet by reading Dr. Oppenlander's book, Comfortably Unaware, which is where the meat and dairy industry want us. And see the film Cowspiracy as well. For the healthcare professionals watching this film, again, Kaiser has already jumped on the plant-based wagon. Research shows that plant-based diets are cost-effective, they lower body mass, they lower blood pressure, make diabetes better. Kaiser wants folks to go plant-based. Because if I don't have time to do the counseling, find a plant-based dietitian. Where do I find a plant-based dietitian? Just do a search there. They're around here. I'll show you in a minute. PCRM has lots of good resources. Educate yourself. They've got evidence-based for weight control, for type 2 diabetes, for heart disease. Plenty of information. You can't play ignorant any longer. They have their nutrition guide on an app for your cell phone. Every disease, they will tell you what the patient ought to be eating. Go to the courses that are being given now. There are gatherings around the country. Doctors should also be taking these courses. Go to the Plantrition Project gathering, and I just spoke at the meeting in San Diego for plant-based physicians. 1,000 plant-based doctors from around the world came, from Ireland, India, Malaysia. It was wonderful to see them all. The American College of Lifestyle Medicine. People say, oh, that's woo-woo California stuff. No, doctor, it's the most powerful specialty of all, because it will cure these patients. If you're in Washington, D.C. and you're a health professional, go see the Barnard Medical Center there, and you can watch the plant-based medicine be practiced. So the year of applied nutrition is dawning. Be part of it, to my colleagues. Both you and your patients will benefit, and medicine becomes fun again. So you can give classes in your waiting room in the evening, spend an hour and then weigh the patients in, have them talk about their problems and their successes, give them a presentation, and then invite them back. So, wake up, doctors. Plant-based diet is the keys. Do it yourself, become the change you want to be, educate yourself, and enlarge your scope. And people get healthier and medicine becomes fun again. I've got all of this on videos that are available for sale, and if anyone would like to do a telemedicine consultation with me, go to my website on the contact page, and you can connect with me, and we can have a Skype conversation about your medical concerns. Okay, long talk, but it's an important topic, and it's an exciting time to be in medicine. My colleagues are holding back. I want to yark up into the 21st century we belong, and finally get this population of wonderful people like you healthy for real, so I can go out for a bike ride instead of concerning about everybody's cholesterol levels. So thank you for listening, and go live long, healthy lives and eat a lot of plants. If you have time for questions, you have to leave, but I've got some questions. Yes, there's organ in the body. Less is more. I don't care what it does to your cholesterol level. I know what it does to your brain, your heart, your kidneys, your liver. The less ethyl alcohol anyone drinks, the healthier you're going to be. Sir?
First of all, I want to find presentation and say This world needs more doctors with one.
The bike path.
Oh, bike path.
Yeah.
And then my real question is, what about healthy fats? You know, we talked about the cholesterol fats, but what about oils, and oils and avocados and olives? The abundance of those in a plant-based diet, is that impacting your muscle cells and so forth?
Right, to make a long story short, you need fats in your diet. You get it out of walnuts and avocados and olives and flax seeds because they get into the bloodstream very slowly and don't cause any problem in your bloodstream. These oils are just liquid fat in the bottle. They leak into your bloodstream. They coat the red cells. They make your blood thicker. They increase blood viscosity. They change hormone levels. No other animal squeezes the fat out of olives. Get your fats out of whole foods, not out of glass bottles. The only reason you use these oils is stir fry your veggies and make salad dressings. You can make salad dressings in the blender in 30 seconds with no oil. Just Google recipes for plant-based, oil-free salad dressings, vegan. Take some veggies from the salad, take some carrots, celery, broccoli, and just throw in the blender with a cup of water, a couple of walnuts, a piece of an orange, hit the button, salad dressing, you pour it on yourself. You don't need olive oil to make salad dressing. And you can stir fry your veggies in anything that's wet, water, veggies. You don't want to run short of DHA. This is the stuff that's in fish oil, but fish don't make it. It's the algae in the oceans that make it. The fish swallow the algae. There's algae oil in their flesh. You need this stuff for your brain, and there are studies that show that long-term vegans can run short of DHA and it affects them. So you can get algae-derived DHA at the store, and I take one most days just to make sure that my DHA level stays up. But yeah, in theory, you can get it out of a handful of walnuts and a couple of tablespoons of flaxseed, etc. But of the two supplements I take, some algae-derived DHA I think is appropriate. It's the easiest thing to do. Okay? Okay. Pardon? What's the other one? I take Dr. Furman's Men's Daily Multivitamin. I have no financial connection with him, but he took all the bad stuff out, but he left B12, D, zinc, and iodine in there, and in the right amount. So I just take one of his and a DHA, and I'm done. And check that out. Okay.
I'm sorry, we have run out of time.
Okay. Thank you all. Take care. You don't want to run short of DHA. This is the stuff that's in fish oil, but fish don't make it. It's the algae in the oceans that make it. The fish swallow the algae. There's algae oil in their flesh. You need this stuff for your brain, and there are studies that show that long-term vegans can run short of DHA and it affects them. So you can get algae-derived DHA at the store, and I take one most days just to make sure that my DHA level stays up. But yeah, in theory, you can get it out of a handful of walnuts and a couple of tablespoons of flaxseed, etc. But of the two supplements I take, some algae-derived DHA I think is appropriate. It's the easiest thing to do. Okay? Okay. Pardon? What's the other one? I take Dr. Furman's Men's Daily Multivitamin. I have no financial connection with him, but he took all the bad stuff out, but he left B12, D, zinc, and iodine in there, and in the right amount. So I just take one of his and a DHA, and I'm done. And check that out. Okay.
I'm sorry, we have run out of time.
Okay. Thank you all. Take care.
Well, that was an awesome presentation by Dr. Klaper, and I hope that you will share it with your friends, and most importantly, please share it with any physician that you can, because Dr. Klaper wants to get this word out to all the physicians so we can help a lot more people. And remember, please put your comments below and click here to subscribe. And until next time, be strong, be well, and be green.